Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Today in Neighborhood Health Watch, obesity and its impact on patients needing joint replacement surgery. If your weight is significantly higher than it should be and you need a total knee or hip replacement surgery, your doctor might urge you to lose weight before the surgery. Studies have shown severely overweight patients are more likely to have serious complications, both during and after the surgery, than a patient of normal weight. Dr. Gregory Schroeder with Parham Doctors Hospital is in the studio today to talk about those risks and also ways to avoid potential problems. Why is it so important to be in good health, the best of health, before surgery?
Well, it's interesting. Even though patients may think they're in good health and fit for surgery, doctors, we want our patients to get the best results they can after surgery. And unfortunately, with morbid obesity, you're at higher risk for diseases such as cardiovascular disease, hypertension, sleep apnea, diabetes, and diabetic neuropathy. And these things can lead to increased complications associated with anesthesia and establishing an airway, postoperative complications such as bleeding, infection, pulmonary embolus, blood clots, and things like that. So we want our patients to be aware of these and do everything they can to diminish these risks with surgery.
Right. Describe the patient in this high-risk group in terms of their body weight.
Well, studies have shown that patients with a BMI over 40 have a much higher risk of joint failure and these intraoperative and postoperative complications than patients of normal weight.
How can you determine your BMI?
Well, it's pretty easy to do. You can go on the internet and you can put in your weight and height, and it will give you your BMI. And patients with a BMI of 35 to 40 or more are at much higher risk for these complications.
And give some suggestions on ways that people can get into the best health to have that surgery. If they've been already been signaled by the doctor to say you need to lose weight, what should they do?
Well, one of the best things to do is get with your family doctor and get into a medical weight loss program, because even a weight loss of 5 to 10% of your excess weight, getting rid of that weight improves your outcomes with these surgeries. And if medical weight loss doesn't work, then surgical weight loss may be an option.
Are most patients on board when you tell them you need to lose weight? You can't get that hip replacement or total knee replacement?
Not really. Again, most patients think they're pretty fit and in good health, but once they realize they have a BMI of 40 or greater, some of them may be upset that they can't get their total joint because they're hurting and they want that joint, and all of a sudden they're being told they have to lose weight.
All right, good information. Dr. Schroeder, thanks a lot.